I want to talk to you today about high-risk pregnancy. Pregnancy is a wonderful time when you have miracles occurring inside your body. Over 280 days, a single cell turns into a newborn baby. And it's a very wonderful time, and it's an expectant time, but it's also going to be very frightening. And there's a category in medicine called high-risk pregnancy, and people always want to know, am I high risk, am I not high risk? And the truth of the matter is this, is that designations like that are not that important. We as obstetricians need to know that you're healthy and your baby's healthy. And yes, there are things that can increase risks of health problems, such as diabetes or obesity or hypertension or a myriad of issues. But in general, if you're healthy enough to get pregnant, you're healthy enough to have a healthy baby. So to me, as an obstetrician, in the 15 visits that we see a patient, the thing I'm always focused on is the baby healthy. I can tell that my patient's healthy because she walks in the door, I'm looking at her, I'm talking to her, and she can tell I'm healthy. We're having a conversation. The only person in the room that we can't really tell is healthy is the baby, because the baby's inside her body. So we listen to heart tones, we do ultrasounds, and we know in that moment that the baby's healthy. But what about between doctor visits? To me, the most important thing that a woman needs to know is kick counts. In the same way that when a baby is born and lying in a crib or a bassinet, the baby will be sleeping for a few hours. The baby's also going to be crying and moving around and looking for food and looking for attention. So in the same way that that if your baby was lying in the crib and hadn't moved for 10 hours, that there would be something wrong, it's the same thing as when the baby's inside your body. So every 3 hours you should pay attention, make sure that your baby's moving, have something to eat. If the baby moves around, then you know that your baby's healthy and your baby's fine. If the baby stops moving around, you don't wait till the next morning. If you have a term baby or a baby that's a month before the due date or 2 months before the due date, we recommend you get evaluated in the doctor's office or in the hospital immediately, and don't miss an opportunity to make sure that your baby's okay, because unlike when you or I are sick, we lie in bed and we get better. The difference is with babies is that if they're sick inside your body, they don't get better. We need to know that before anything tragic happens. So our goal is to have a healthy mom and healthy baby, and kick counts are the most important thing for a woman to pay attention to.